Well, this week, the flu activity in central Ohio is considered low. That's a good thing if you haven't yet received your flu vaccine. Before it spreads to your community, though, the experts from Licking Memorial Health Systems are giving us the 411 on prevention. We are talking with CEO Rob Montagnes and Director of Infection Prevention, Jean Emmons. So thanks for being here, you guys.
It's great to be here. Or should I say it's not great to be here?
Right. Who knows? And what you're going to say is the truth. Let's just tell people, right? We're not going to tell them the opposite.
We're not going to do opposite.
No. All right, Rob, let's first talk about Licking Memorial Health System's kind of comprehensive plan to make sure that your community is protected from the flu.
Sure. I think one of the things we've seen over the past 8 to 10 years, which has been outstanding, is the availability and the awareness of the flu vaccine. Many stores that you walk into offer it for very low prices or perhaps even free. Obviously, all of our providers, we do at the hospital as well. So I think the availability and awareness is important. The key is it tends to get greater attention during sort of epidemic seasons where there perhaps is a very well-known or deadly flu, if you will. But realize that 40,000 people will die each year from the regular flu. And that's why we spend so much time educating our community and really encouraging our providers to get the flu vaccine. It's a very non-invasive, inexpensive way to combat something that could result in some significant consequences.
Yeah, it's very simple. I mean, we all get it. We have somebody that comes here to the station to provide it. So a lot of places are making it very easy to get. So Jean, you are still offering the vaccine, right?
Yes, we still offer it through our system.
Okay, which is always good to know. So let's talk about some of kind of the misconceptions. Lots of folks out there say, and I've had this one a lot, well, I get the flu vaccine and then I feel like I'm getting the flu.
Right, that is definitely the most the flu vaccine. It's a dead virus that's built into the vaccine, and so you do not get the flu from the flu vaccine. There are some people that could have maybe mild achiness the day after, but that is not flu. The true flu, influenza virus infection is you're pretty much down on your back for 5 days or so. Now, a lot of people do come down with an upper respiratory infection after they get the vaccine. It has nothing to do with the vaccine. It's just strictly a coincidence with the various vaccines that are circulating this time of year. I mean, if you look around, the majority of the workforce in our community have upper respiratory infections right now.
Oh yeah, I just am getting over one still. Last week was coughing up a lung. So I mean, had I gotten a flu vaccine, you think that's what a lot of people do, is they kind of relate it to something that's happening.
They do.
Okay, any other myths that are out there?
Another myth is I've never had the flu, so I don't need the vaccine. I'm very healthy, I've never had the flu. Well, there's always a first time, and it can be a pretty debilitating illness. And the other thing is we want to vaccinate the herd, is what we call it in healthcare. You want your community to stay healthy, because those of us that are healthy and get a vaccine, or if we do get the flu, we don't get as sick as those that are more vulnerable. So we really need to protect the elderly by getting a vaccine, or the young, and those with the chronic illnesses.
And when should we get the vaccine in order for it to really help us? Because I know sometimes it takes a little bit for it to kind of kick in.
Right, it takes 2 weeks for it to kick in. However, the flu season extends really from September to March. So anytime in that period, you can get the vaccine, but obviously you want the longest effect from it, so you really want to get it early. But that's not to say it's too late right now. I mean, obviously we're still, because the activity is so low, we don't know where it's going to go. We don't know if it's going to really amp up, but it's just good to get it, so you're protected.
And you don't ever need, or do you need, any kind of like booster, or it's just an annual one vaccine that you're getting for the flu, right? Because every year it changes.
It does. The vaccine is manufactured differently every year based on what the activity they're seeing in other parts of the world, where it comes on earlier than what it does in the U.S. So that vaccine's formulated for what they think is going to be circulating in the U.S. And I will tell you that early studies are showing that this vaccine is a great match to the virus that's circulating this year.
So this year, there's no reason for you to say it's not going to protect
Right.
me.
Right.
Go ahead and get it.
Right. That's a very important point, because last year it wasn't the greatest match, and we did see a lot higher activity.
Okay, Rob, do you feel that flu vaccination, talking about your healthcare workers, that should be mandatory and that will eventually become that way?
I think we should have an expectation. I think the public has an expectation that as healthcare providers, we will do what we need to do to keep them safe and protect them. And so I think getting the flu vaccine is something we have an expectation, and I think most of the, as I said, the community does. We reached 94% this year, which is, I think, extremely, extremely good.
That's great.
I know we would always like to be at 100%, but there are some clinical contraindications for certain folks. But I think you're going to see that become much more common and much more of an expectation of healthcare workers.
Absolutely. All right, Rob, Jean, thank you for being with me.
Thank you.